to our webinar, Clearer Futures, Identifying Eye Care Needs in School-Aged Children. My name is Harper Byers. I'm a coordinator at School-Based Health Alliance, and I am proud to welcome you to our webinar today. Thank you so much for joining us this afternoon. As some quick reminders before we dive into content here, you are in listen-only mode. If you have a question as we move through the session for our two presenters today, we encourage you to use the Q&A section, which should be available at the bottom of your Zoom controls panel. And if you would like to turn on closed captioning, you can click on the CC button. We also invite you to complete our evaluation poll questions that we will broadcast at the end of our presentation today. I am joined today by two of our amazing colleagues. Donna Fishman, the director at the National Center for Children's Vision and Eye Health at Prevent Blindness, and Luke Ertl, the program director at the Association of Clinicians for the Underserved. I am co-MC today with my colleague Daniel Dobbins, who is a director at School-Based Health Alliance. And as a reminder, my name is Harper Byers, and I am a coordinator at SBHA. Our two content presenters today are Dr. Sarah Bodie and Dr. Angel Barajas. Dr. Bodie is a primary care pediatrician and the medical director of Nationwide Children's Hospital School Health Services. She is the immediate past chair of the AAP Council on School Health. Her clinical work and research centers around the intersection of health and education and providing care for the underserved. As medical director for NCH School Health, she provides oversight for 20 school-based health centers and 2 mobile medical units providing comprehensive primary care to improve access and eliminate non-academic barriers to learning and to improve the health and education of children in Ohio. She also serves as a school health consultant for the Ohio Department of Health and as the chief medical consultant for the largest school district in Ohio, Columbus City Schools. She is committed to training providers in the field of pediatrics through policy and community action and serves as director for the AAP's Community Pediatrics Training Initiative. Dr. Barajas is an assistant professor at Western University of Health Sciences, College of Optometry, where he teaches and provides patient care primarily at the Eye Care Institute. He educates student clinicians across multiple modules, including pediatrics, neuro-optometric rehabilitation, community health, and off-site clinical offices such as Parktree, Ultimed, and Lestonic. He teaches advanced procedures in optometry with focused instruction in laser-based procedures and minor surgical techniques, helping prepare students for full-scope clinical practice. In addition to on-campus and community clinic responsibilities, Dr. Barajas regularly travels to schools within the San Bernardino Unified School District, providing eye care to students K through 12, including those enrolled in special education and special needs programs, a role that reflects his commitment to access, early intervention, and community-based care. Prior to joining Western U, Dr. Barajas practiced for over 2 years in private practice, serving in the communities of San Bernardino, Redlands, and Rancho Cucamonga. He earned his Doctor of Optometry degree from UC Berkeley School of Optometry in 2018. While his time in the Bay Area was formative and memorable, Dr. Barajas then returned to Southern California to remain rooted in and give back to the community that shaped him. If you are curious about learning more about SBHA, we encourage you to check out our website for resources and information about our initiatives. And with that, I will turn it to Donna to introduce her organization, Prevent Blindness.
Thank you so much, Harper. I'm so happy to be here today and to partner with the School-Based Health Alliance and the Association of Clinicians for the Underserved in sponsoring this webinar. Prevent Blindness has a very simple mission, which is to prevent blindness and preserve sight across the lifespan. I direct our National Center for Children's Vision and Eye Health, and our mission is to improve all of the systems that support children and the interaction of vision with education and early childhood, making sure children are meeting their developmental milestones throughout their life. And so we do a few different things. We have several partnerships, such as the ones you're seeing today, with other national organizations, with federal agencies, to make sure that vision is a part of all federal surveys, to make sure we have data and surveillance around children's vision. We do training for all professional education. We train people to do evidence-based vision screening, both in pediatric primary care and school settings, childcare settings, things like that. And then we provide technical assistance around anything from starting up a vision program to how do we collect data on children's vision in our local communities. So we consult with school districts, we help develop guidelines for vision screening. And so we are here for all of your vision health needs. Thanks so much.
Thanks, Donna. Alrighty, and our learning objectives for this afternoon, participants will be able to describe common vision and eye health conditions in children and explain how these conditions may affect learning, development, and overall well-being. Participants will be able to recognize key signs and risk factors that should prompt further vision evaluation or screening. And lastly, participants will be able to identify effective follow-up practices to support timely access to appropriate eye care services and ensure continuity of care. This will come back to our poll at the end of our session today, so keep these in mind as we move through content. And with that, I am proud to pass it to Dr. Barajas.
Thank you for that introduction, Harper, and hello, everybody. Thank you for being here. My name is Dr. Angel Barajas, and today I'll briefly walk you through how vision develops in children, highlighting some common concerns, including myopia and diabetes, and then close with how collaboration, especially with school nurses, can play a key role in early identification. In the next slide, please. Vision plays a major role in how children learn, interact, and participate in the classroom. The challenge is that many of these vision problems aren't obvious. Children often don't realize or communicate that something is wrong. So early identification becomes really important, especially in school settings where you're seeing these students every day. Next slide, please. Vision isn't something that children are born fully developed. It actually improves over time. So as children grow, their visual system is constantly refining how they see, focus, and coordinate with both eyes together. When that process is disrupted, even slightly, it can actually impact how they engage with reading, schoolwork, and activities. The next slide would show you here the most common categories, the most common things we see, and they all fall into these specific categories. With refractive error, we talk about blurred vision being at distance, near, or sometimes even both. With alignment issues, we're talking about how the eyes don't really work well together or properly. And then the last category is that focusing or coordination difficulties can become a thing. And I'm going to dive in deeper into that as kind of how they manifest to each other. But what's important is that these don't always present as vision complaints. They actually often kind of just show up as learning or even attention concerns. In the next slide, you'll be able to see kind of images demonstrating two halves of the coin. On the left-hand side, you have the anatomical representation. With normal vision, we want the spotlight to hit the retina spot on. In myopia, it falls short of that. Hyperopia, it almost overshoots the target. And astigmatism, it's almost like multiple spotlights. Now, in a real life perspective, that can cause the vision, like the images of the boats over there, to have fluctuate. And so you kind of get a little perspective as to what the student might feel in life. With the next slide, you'll actually be able to see pictures of eye alignment issues. Sorry, forgot there were zoom in graphics here for you. So in case you need a little bit closer look, because myopia can kick in. That's what that one was for. With strabismus or eye alignment issues, sometimes it's as obvious as the image shows here for you. And if it's not straight ahead, you can kind of tell, depending on which eye coordinating, what type of eye alignment issue there may be. If you don't mind hitting the next slide, it might zoom in, and I imagine. When this one here actually gets into more details, this is where eye alignment can actually go more undetected, because sometimes it's not as obvious as the last image showed. It is more so showing up when they're reading. You might get a shadowing effect as they read. We call that convergence insufficiency. If you click, I think it might zoom in again for you. Versus the other one, once its graphic kind of passes up here, shows you more what we call amblyopia, or as most people actually call lazy eye, where the brain sets in. And at that point, the eye itself might work in terms of an anatomy function, but then the brain itself won't let it see to the best of its abilities. With the next slide over here, This is where your role might become very powerful. Signs can be simply squinting, covering one eye, tilting of the head, frequent headaches, or even trouble concentrating. Some of these kids avoid reading or bring things very, very close up. So importantly, these signs can actually come from a lot of us, teachers, families, or even your just own observations yourself from a passing glance. Even if a child passes a screening, these concerns will matter and still matter. We're going to shift into a little bit more specifics now, talking about myopia here. This is the condition that we're seeing more and more of, also known as nearsightedness. These students have trouble seeing the board. They're squinting all the time, or they might move closer to see, or they might get moved closer to see. This often can develop during the school age years, but will progress over time. So recognizing these behaviors will help guide them and have timely follow-up. The next slide will show us here a graph where in Sydney specifically, 31% of 17-year-olds were myopic. And this is about 10, or this was about double the prevalence studied by the Blue Mountain Eye study just about a decade ago. So it doubled in just 10 years. So that rate is pretty impressive at that point. And the exciting thing with the next slide over is that we have better ways to manage this now. And for that, these are the categories they fall into. With context, we have two tracks of route to go with. The first track is one that most of us know about as soft contacts. There's now a soft contact that will help train the eye to not grow at an exponential rate. The other option in the world of contacts is more of a hard lens. We kind of treat it more like a retainer. It helps mold the eye of the student sleeps, and when they wake up, not only do they see, but it actually also stiffens the eye or tricks the eye from not growing. It's actually something what the drop from the pharmaceutical side of things does. The drop itself will also stiffen the retina from growing, letting it kind of just go through its day along with the use of glasses, and thus, again, tricking the eye to not grow. Now, as of late 2025, we actually now have special glasses, which is what the image on the right-hand side shows. If you look carefully in the image, there's little white circles in there. Those little white circles are actually little blur spots. And that again is trying to trick the retina to say, hey, you are good where you are. See the world as you are. Please do not grow. And you might find that one happening actually. In the next slide, we're going to shift gears and talk about diabetes because a lot of us are starting to see that with our students nowadays. With diabetes, vision can fluctuate based on blood sugar levels. Students may report that their vision changes throughout the day to day, or things may seem blurry only sometimes. These symptoms can be subtle. It can be helpful to keep that in mind with students who have these medical conditions. Dr. Bodie will go more into depth with that on the primary care side of things, but I'll give you the retinopathy, diabetic retinopathy side with the next slide of things. Or next slide, please.
Dr. Barajas, before we get into the next slide, there was a question about, do we know why the percentage is going up for instances of myopia?
Great question. So, of course, a lot of it is kind of just still theoretical. There's no definitive answer per se because we kind of separate myopia into two tracks, genetics and environmental. On the genetic side of things, if your parents both wear glasses because they're nearsighted, well, then the thought process is you're going to become nearsighted. But this is where the environmental argument comes from. And as we are advancing as a society to learn and read more, then in theory, that is what our thinking is pushing us further that way. That combination is what is the more kind of leading you down the path of nearsightedness and myopia. But of course, we don't want to discourage learning and everything, which is what makes this a difficult balance. So that's why it's a difficult exact answer to pinpoint. There's not one definitive way to answer that. Great question.
Yeah, thank you for that.
So with the next slide, I can talk a little bit more about what to look out for when it comes to diabetic retinopathy. That being that type 2 is actually a bigger concern of type 1. And that is mostly due to the fact that type 2 might actually be lingering blood sugar spikes or have had elevated blood sugar spikes for a long period of time before they fully make the diagnosis. With type 1, and again, Dr. Bodie will go more into detail, but it happens pretty suddenly. As such, we actually don't have to worry in terms of the eyes, retinopathy-wise, until after puberty. But after that point, for both sides of the coin, we then encourage more routine examinations, more follow-up. With the next slide, you guys will get a taste of kind of what it can look like, again, more from an anatomy and more from a visual perspective. On the anatomy side, you click and it might zoom in again. Here you'll be able to see, I just did it, sorry about that. It's like you see it essentially blood vessels leaking. The eye is hurting. It's asking for more blood flow, and yet it's not receiving it. So it's just kind of over presenting itself. Eventually, that will lead to what the images on the right-hand side shows, which is spots of blurred vision or even complete darkness. And that is what we're all trying to prevent here when it comes to those patients. So diabetes, again, is something to definitely keep an eye out for all our students here. Now we can move on to the next slide here. So vision screening is essentially the first critical step with this. It really helps identify students who may need further evaluation and follows established guidelines. But it's important to remember that screening is not a diagnosis. Every child with a vision concern, not every child with a vision concern will fail a screening, which is why your guys' observation and just communication is very important. So the next slide, this is where school nurses come and play a big role here. They are central to this process. Y'all are the ones conducting screenings. Y'all the ones tracking results and noticing patterns oftentimes. So it's a key connection to point between the students, the families, and the providers of which you facilitate all of the combination of is huge when you identify these students who might, I mean, this whole thing is just huge when you identify these students who essentially would be missed in the system. So with that, I get to hand it over to Dr. Bodie to give the primary care side consideration of things, unless there's any questions.
While we gear up for that, we did have just a couple more questions. So one was, what type of screening are you referring to when you were talking about the conducting screenings for the regulations? If you can just give an
So when they talk about screenings, we do have to make sure that every state follows their own specific guidelines. So I want to make sure you guys all are aware of that. So you do have to reference back to that. But at least in California, I can talk about a screening, even it being as simply as checking visual acuity, checking pupil kind of function, and even a quick eye alignment, which can be simply just by covering one eye at a time. Again, just speaking from California, but every other state would have their own other versions of that. We also do include color vision screening in our state as well. So at least some of that. I'm sure they all kind of flock together of some sort.
No, thank you. One more before we transition to Dr. Bodie. More recently, we have a attendee that indicated more recently they've seen fewer eye doctors recommending corrective lenses for their kindergartners, despite having a diagnosis. And many of those students needed additional referral shortly after starting school for observable signs warranting examination. And so they're wondering, is there a reason for that? If any of you know or experience with that.
That's a great question. I'm sure there's probably more to the story. Maybe they found something with eye alignment or something else to it. So it's a little hard to just infer from that, to be honest. Maybe my heart hopefully tells me that maybe they want to start some myopia management treatment or something. Maybe they're thinking outside the box. But I don't think I can fully comment as to what the decision making was for that piece, potentially, or those pieces.
Thank you.
Great. Thanks, Dr. Brauhaus. Part of what we're talking about now is like, how do we loop in primary care consideration? So, we're talking about this in the school setting. So we're going to talk a lot about role of the school nurse, role of our vision care doctors, and then role of primary care. And how do we set up an ecosystem where we're ensuring that we're supporting school-age kids and not letting anyone fall through the cracks? Next slide. So we're just going to talk a little bit right now about what is the role of primary care providers in identifying some of these school-age students with vision concerns, what screening recommendations exist for primary care providers, how do those differ maybe or complement what's happening in the school setting. We'll touch a little on what medical conditions are associated with some visual disturbances we have to think about. And then lastly, really thinking about what is the role of these school-based health centers or on-site school services to really think about how we integrate a system of support for kids. Next slide. So primary care has a couple in vision assessment, and we're going to talk about all of these. One is that we are also doing annual visual assessments and screenings, and we'll talk about what the recommendations for primary care pediatricians look like for that. In addition to just screening for vision, we're also looking to identify like coexisting medical conditions that may be associated with those, or who is at higher risk that needs to go on and have further visual assessments every year, whether or not they're having symptoms. And then what is the process of coordinating all of this together for referrals for eye care for our school-age kids. Next slide. So as many of you on the call may already know, when you're going to primary care pediatrics, they are following Bright Futures. It's the Bible for preventative medicine for kids. And when we look at the AAP guidelines for vision care, this is just important considerations to think about. One is that as pediatricians or primary care providers, when we're seeing kids, we're starting right in the newborn period and assessing vision. So what does that look like? Of course, in a newborn, but a lot of that has to do with making sure they do have that appropriate red light reflex, that their external, examination of their eyes doesn't reveal any abnormalities. Pupils are equal round and reactive. Those are really important first things. And as a pediatrician that's practiced for several years, I can tell you that we do identify a lot of concerning eye conditions that may exist from that newborn period on. So it's pretty important for us to be thinking about doing that. As a child is getting older and we're doing that, at some point then is when we're adding in those additional testings. And that has a lot to do with instrument-based screening in those younger kids. So when we have kids that are a little bit older, but they're not able to respond and do the traditional visual screening, we're often using those instrument-based screenings. And those instruments are often used by school nurses too. So when you think about all of the different companies that make those, whether that's SureSight or other, instruments that folks use. Again, as Dr. Barajas said, depending on your school district and rules for screenings, some of those instruments may be allowable or not allowable. Obviously, you're doing the back and forth traditional vision screening is the most comprehensive, and that's what you're working on with students. But all of us are caring for students that may not be able to complete that screening, and then that's when the instrument-based screenings might come into play as well. So lots to think about as far as like how you're doing the screening, but just to know that in pediatrics, you have all of those options available to you, and your pediatrician or primary care provider should be doing those on a routine basis, at least once a year. Next slide.
Dr. Bodie, there was a question if in pediatrics, are you all informing parents about the need for proper sun protection as well? Does that often come up?
Oh, yeah, all the time. Absolutely. So actually, lots of specific pediatric recommendations for sun protection, some of which talk about clothing, UV protective clothing for our youngest kids, thinking about how long they can be out in the heat, what does that look like? So again, from newborn period on, there's a lot of different guidance per age on what we would recommend, when you can put on products, what should be in those products. So that's definitely information that pediatrics would weigh in on.
Thank you.
Yeah, next slide. So, in addition to doing vision screening, we're obviously also getting, number one, a family history, but then a personal medical history. So, again, as Dr. Barajas said, in a strong family history of folks that maybe have hereditary eye conditions, or even just significant history of myopia in several of the family members, that's going to heighten your concern as a primary care provider and may actually lead to you referring to comprehensive eye care earlier without any signs or failed screenings. And then here are some additional medical conditions that are associated with vision impairment that, again, would always make you want to connect to an eye vision medical home to be allowing those children to get those comprehensive exams at least once a year. So congenital conditions do exist. You can see several of them here. You can even have optic nerve underdevelopment, which again may not have any other signs or symptoms other than some concerns about vision impairment eventually. Obviously, you can have acute injuries to the eye. And then, as we were talking about, a lot of systemic diseases. So mentioning that type 1 and type 2 diabetes, that would be really important for you to, again, think about referring those kids on to a vision medical home. And then really, again, again, looking at that systemic review. Retinopathy of prematurity, just to put a note here, we talk a lot with families about this when kids were born preemie and they're little, but sometimes by the time they get to school age, some of that medical information has been sort of put in the past and parents may not be sharing it. So then you may have a school age child that's having some concerns with their vision, and maybe it's no longer anywhere in their history or school history that they were a former preemie and are at much higher risk of ROP. So these are all things, again, just to like consider as we're getting a comprehensive family and personal medical history in the pediatrics office, which is why I think it's so important to make sure we're connecting back. The last thing to mention is just, of course, there can be brain-based visual impairment where there's nothing wrong with the structure of the actual eye, and those can be even more challenging things to, talk about and assess. And again, an instrument-based screener may not be the best choice for those kids because that's not going to pick up those anatomic conditions. Next slide.
Dr. Bodie, I know that you're going to get into more of the connection between health and education. We did have a question come in about what the role is for other people in that ecosystem. So your school social worker, how they can support and what their role is in terms of recommending and getting kids screened.
One thing I will say is that and we'll talk about this later, but in school health, open door policy, right? Like kids have so many different interactions, and I'll share an example later, but even like coaches, right, might be the first one to notice some of this. And then as kids are getting identified with vision concerns and we're waiting for them to get connected to services or they're getting a new treatment, then what is the plan or social supports for those kids? Many of them might have some other coexisting symptoms that may be from the vision impairment or in addition to with some frustration with their academics or behavioral outbursts in response to that frustration in younger kids. So you can think about all the different roles and how important it would be for social worker, for behavioral health counselors, for the school nurse, coaches, teachers, all of them to be a part of the solution to get that child the support they need.
Thank you so much.
Slide. Yeah. So this just talks about that relationship between health and education. I love this slide because as a pediatrician, it's such a reminder to us. So, in pediatrics, we talk a lot about how if kids aren't healthy, their education is at risk. And we just mentioned those, right? Kids coming to school every day, they can't see, then, that's going to make it much harder for them to learn. So we talk a lot and think a lot about how we're addressing those health conditions. But the other thing to just mention is that education is one of the most important social determinants of health. So as a primary care provider, I care as much about how that child's going to do in school and be successful and meet their potential as I do their physical health, because that is such an impact on how they're going to turn out and meet their full potential and be a healthy, happy adult. Graduating from high school opens up so many opportunities for kids as it relates to income, resources, their neighborhood they may be able to live in, all of those things that we think about as far as having those kids lead healthy, successful lives. So, pediatricians, primary care providers, anyone in the ecosystem taking care of kids, this is an all hands on deck approach. I'll share a couple of examples of that briefly. Sorry, previous slide. So, for example, one of the things that we've been thinking about recently in our primary care practices at our hospital is when kids start kindergarten, are they ready? Are they ready to learn? Are they passing all the tests that they need to do to have their early literacy skills, their numeracy skills? What's happening as they start? And if a child's coming to me for every checkup from birth to kindergarten, then that means they've come and seen me 15 times before they start kindergarten. So that is a real opportunity for me as the primary care provider to be connecting with both how they're doing as far as their development, but how are they doing with their early literacy skills too. And so, for example, one of the things that we're implementing now is literacy screening in young kids at 3 and 4, and really thinking about how are we intentionally connecting those families to high quality education supports and services. So high quality preschool programs, library programs, after school or home literacy programs. So it's really just to highlight the fact that this needs to be done as a team approach. And we're going to talk a little bit about the gap right now and how school health is one of the ways we look to close that gap. So what does that look like when you have kids in school? So part of it's like really this acknowledgement that not everyone goes to the doctor or gets there regularly. So this is my state of Ohio results, just to give you an example, but there are similar examples across the country. And for us, when we take that K through 12 population across the state of Ohio, only half of the kids have a medical home that provide a usual source of care. So half of the kids that are school age are not going to see a primary care provider regularly. And as we were just talking about as it relates to vision, that's a big problem because there's a lot of things that happen at that visit in addition to a vision assessment. And if a child's failing their vision screening, yes, they need to get to an eye care provider, but the primary care provider is just as important in that and can help with that linkage and coordination. So 22% didn't even have a place to go or consult when they're sick or have an acute issue. So again, how are they following up with this? And then really thinking about the burden of disease on our kids and some of those chronic conditions, mental health being one of the ones that can be the most common in these age groups. Next slide. So this is also from the state of Ohio, but when we do our comprehensive vision screening by the school nurses in every public and charter school across the state of Ohio, about 20% of the kids who fail their vision screen have confirmed follow-up with an eye doctor. 20%. So it is not enough for us to just have the school nurses have the burden of connecting those families to care. And we're going to talk about some amazing programs. And I think Dr. Barajas is going to close with some on-site vision programs. And this is so critical to like close that gap. But again, everyone's got to be part of the solution to think about how we're connecting those kids. And so bridging that gap between the healthcare system and the school system is what this is all about. And vision care is such an important component of that because it's one of those things that if we're missing is a real tragedy, right? And it's a real issue for our kids, and they will not be making either their health outcomes or their education outcomes. So definitely requires us to think outside the box here together. Next slide. So this is just to relay that this school health services can be a solution to this, and these are all about partnerships. Sometimes when we talk about bringing school-based health centers or other school health services like vision services to school districts, sometimes people say, well, you already have like school nurses, or are you trying to replace school nurses if we're bringing primary care services? And so this is just a slide to really highlight that both of these positions are mission critical for the health of kids that are school age, and they work in tandem together. So our school nurses are working incredibly hard, not just to like triage acute things in schools, but also to manage chronic conditions in schools. So they have so many nursing services that they're providing: medication administration, individualized health plans, emergency plans. They're often the one medical provider in a school that's training a lot of other school staff in emergency procedures. And then they do a lot of our health assessments. So our school nurses are often like the boots on the ground first people that are one of our most important people referring and identifying these kids with concerns. And then our school-based health centers are, again, doctor's offices inside schools. So they're doing that next level of care in partnership with the school nurse. So think about school nurse triaging an acute injury or an acute condition. Maybe she sees a child with a fever and they have a red throat and it looks like strep throat to the school nurse. Well, the school-based health center can assess that, treat it. Either it's negative and kid can be back to class, or it's positive, they start treatment and it gets the kid back to class earlier the next day or the one after. So again, this is really about that partnership, and it's very critical. Next slide. So what does this look like in a school setting for vision concerns? And Dr. Barajas mentioned a few things. I'll just go into a couple more. Obviously, school nurses are doing the screenings, and depending on your state, what does that look like? In the state of Ohio, for us, it looks like kindergarten, first grade, and then every other through the end. So they are doing those comprehensive vision screenings for kids at that level. And they also might be seeing kids for conditions that they're coming back. So they might be treating someone for recurring headaches and really thinking, gosh, is there something more going on here? Could this be a vision concern? Teachers may notice the eye rubbing or head tilting or the vision, but they might just notice behavior concerns. They might just have a kid who's checked out, who used to be interested and is now just like in the back of the class and disruptive and not paying attention. But, some of that could be from that. Coaches might know a difference in athletic performance. If you have a child who's had strabismus and is now developing some amblyopia, that can affect their depth perception. That could be an issue and noted. Counselors might be getting referrals for these kids because they're frustrated. They're frustrated with their academic performance. They might have some emotional distress related to this. So again, the solution here is open door policy, really good communication from the school side to the health side and back again, and really involving your school-based health provider. And there's a lot of information from the School-Based Health Alliance too about, what it means to communicate back and forth, HIPAA, FERPA, how you set up an ecosystem to do that well. And so we can definitely refer you to some additional resources for that, but it's really just this idea of partnership. Next slide. So let's just talk about a case to bring this home. So here's an 8-year-old boy that presented to the School-Based Health Center, really presented for ADHD evaluation. So this was a little guy that was having a lot of inattention and definitely some impulsive behaviors and disruptive behaviors in class. And teacher noticed a lot more poor academic performance, particularly this year. And on further history, did end up noting that the school nurse had done a vision screening for that child a few months past, and he did have a failed vision screen and had been referred for eye care, but just had not been able to follow up with that referral yet. So more information from the teacher when you do that history, just really teachers frustrated, the students frustrated in class, they're fidgeting, they're leaving their seat, concern about those academics. And then the parent history really does say this isn't just an acute change. There was a history of hyperactivity several years before as well. There were some previous concerns about focus and academics, but this year seems to be particularly worse. And again, difficulty with task completion at home as well as at school, so not just a school issue. Did have some trouble sleeping and was complaining of headaches in the afternoon frequently, so that was something of note when you really asked through the history. This little guy was in a club sport in baseball and noticed maybe a lack of focus there too, so mom says just wasn't seeming to be paying attention or doing as well there, and having some poor coordination too that seemed to be worsening. So school nurse reports to you that they did pass, this little guy did pass his vision screens in kindergarten and first grade, but just failed this most recent one, and it was 20/80 in the left eye and 20/20 in the right. So those were the results. Next slide. So lots going on here for this little guy. So from the primary care provider perspective, lots to do. So referral first, of course, vision clinic, right? So really help to, again, just connect that mom to the resource and provide some care coordination so that they could get there and get some transportation to the appointment. And further evaluation from the eye care specialist led to a diagnosis of optic nerve hypoplasia, some strabismus, and unfortunately some developing amblyopia, so had vision loss in that eye. So really needed significant treatment. So did do some eye patching, did have glasses as well, and again, ongoing care. But then there was a lot of follow-up for this. So as that vision care was going on, that was like the mission critical to get that taken care of and see how that affected him as far as his performance in academics, lots of supports. And he did have some improvement in attention to schoolwork, wasn't having avoidant behaviors, but after a number of months was still having concerns. So still trouble with focus, fidgeting, task completion. Headaches did resolve with the glasses use, but eventually an ADHD evaluation was completed and he was diagnosed with ADHD combined type as well. So treatment began there with medication management and a 504 plan with classroom accommodations for both vision and ADHD, and the results were incredible. Improved academics, behavior improved, social skills, and just overall family dynamics at home too. So just really a good success story of how everyone can work together to sort of get this child what he needed. I will share personally, I have a similar but not exact case with my own son. So two pediatrician parents. Our little guy saw the pediatrician every year, passed his vision screenings, and then when he got to third grade, actually, the school nurse did a test on him and thought he was cheating on his vision test. And it turns out he was. So he's memorizing with his good eye what was on. And then when they were asking him again, he was just reciting it. But she caught on to him and did a better vision screen, and he failed it. And my son also had a diagnosis of optic nerve hypoplasia and amblyopia and needed lots of ongoing treatment. And we would have never known that if it hadn't been for that school nurse. So really good at not having obvious symptoms at home. So anyway, just a personal note to say this is so important to really think about all the different people that are identifying kids with these vision needs. It is not always obvious right at the beginning. And I'll turn it back over to Dr. Barajas.
Well, that was fantastic because what Dr. Bodie just said is basically this slide here to remind you that the screening results, they're just a piece of the picture. And it really just takes the village surrounding the student to kind of capture these said cases. And of sort, these observations, sharing and communicating, that's the big key to things. And that's what leads me into my next slide here, which talks about what my university, what I am involved with, and how we partnered up with a nearby school district, the one in San Bernardino County, to really kind of answer or tackle the question of if there's a way to close the loop effectively. So the next slide will show you pictures of that result. We actually are doing full examinations on school site. These are images of our setup. We call them lanes here. So we have four refractive lanes where we check and do eye examinations, visual acuities, refraction on site, and we check for optic nerve hypoplasia. We do dilation exams with parent permission. We do all of that, full scope care in that sense. And so that kind of leads us to doing this more and more so. With the next slide here, we pretty much are showing that our goals are to have that collaboration between the school nurses, and eye care providers. We want to close that gap with clear communication, shared follow-up, and making sure referrals are all completed. You have just better support with follow-up and general care. With us specifically, we actually have frames that are chosen on site. We order the glasses for them, and within a couple of weeks, the students are able to return to class with improved vision. It's been quite impressive, and we've been doing this for about 4 going on 5 years now. So this is pretty cool. When everything's just aligned, it just becomes easier to make sure the students receive the care that they need. So with that, then I can give you our final takeaways. So to summarize, vision develops over time and plays a major role in learning. Early concerns, even the subtle ones, are very, very important. And collaboration between the school nurses, providers, the whole team, the village, everybody helps to make sure the concerns are truly addressed on time and appropriately. So thank you all for the work that you do. It really truly makes a difference for every student. So that's it for me.
Thank you so much. This was great. We're getting a lot of comments in the Q&A. Just thankful for the information. This was a great presentation. I wanted to get us started with Q&A. I know we had some questions that we have not yet gotten to. We've been monitoring throughout the session, and so just appreciate the attendees, your engagement, and just engaging with us throughout. So with the first question, and this is open to anyone really, but there was a slide, and Dr. Bodie, I think it was slide maybe 31, where you talked about the untreated cavities. And so one of our attendees is asking, there was a slide that indicated connection between dental caries and vision, and just wanted you all to elaborate on that.
Yeah, so that slide was really just to highlight the fact that we have a burden of chronic disease in our school age kids and a giant gap in how many of those kids are actually getting like ongoing quality care to treat those conditions. And when we talk about medical conditions that are most common and affect kids in school, dental caries are actually often the number one. medical condition that can affect kids in school and lead to poor educational outcomes. So you can imagine, right, if you're a child and you're sitting there with like tooth pain day in and day out with these untreated cavities, it can affect your nutrition, your focus, all of the things. So part of that consideration is for us to think about, again, the whole child. So if you have a child that's not getting connected to their vision care, they're probably not getting connected to their dental needs and care as well. So I don't have a direct link from like dental caries to vision concerns from a medical perspective. It was really just to talk about how the association of those gaps occur together.
No, thank you. Thank you for that clarification. I know that there was a question, and you all may have caught it already. Dr. Barajas, I think you were answering it, but if you want to voice the question that the attendee had and maybe share out with the larger group.
Absolutely. It was a question regarding the examinations we do on site, whether they are comprehensive and include dilation. So to further elaborate, we definitely do a full comprehensive exam, including ocular motor testing, pupillary testing. Obviously, we also do eye teaming. But the big part of it, if I can say, is the dilation part, which we're fortunate that we do invite parents to always come and see these exams for themselves, as many a times they do involve my students, and they're probably curious to see how my students also work with school students. But since the parents are there, we can easily ask them for permission to dilate in that moment. If not, then usually with the school nurse's assistance, we get the parent or at least one of the guardians on a phone call, and we ask permission that way as well. So we are very comprehensive. We also give out the cool sunglasses at the end.
Thank you.
I'll share in my experience with vision programs across the state of Ohio. I think they're very similar to what Dr. Barajas has set up in that uh, often the consent forms to start with have that ability to ask if the parents are providing consent for eye dilation, if it's determined that it's needed by that eye care specialist. And then as kids are coming in and they're getting these comprehensive eye exams, it's usually determined in that moment whether they need that dilation or not. So depending on that child, the findings that you're seeing. But the other thing I'll have parents often say, and it relates to like eye care vaccines, is like, well, how do the kids handle this, right? Like they're going to scream, they're going to fuss. And I'll let Dr. Barajas weigh in too, but kids do so much better without their parents there sometimes when you have them in this school setting and they're all coming in these vision lanes. It's very routine. They're in their safe space in school. It's not as intimidating because you're not in this like doctor's office. And so really this ability to get kids to cooperate and do these comprehensive eye exams is pretty great. So there's really minimal disruptions there. And then because these eye specialists have the ability to do all of that, then they can really keep that care comprehensive and right at school. So they're now only needing to refer out when they have a child that has something maybe medical that needs followed up on or some other, concerning eye condition that's going to take medical follow-up. But the goal is to be comprehensive, get it done while they're on site so they get their glasses and everything's set up for them right at the school.
Yeah, I'll just echo Dr. Bodie's statement that students tend to be more brave without their parents around. I don't know if they're just trying to hold face between their fellow colleagues or something. It is a lot easier. And then there's all these tools of the trade, the biggest one being our friendly way of distracting them. As soon as the drop go in, they feel the need to, react, but back I can juggle, so I juggle for them in the moment, and then immediately they stop crying. That's kind of one of the tools of the trade as well.
Well, thank you. I know we have several questions in the queue and not going to be able to get to all of them. But is there one last question that you all want to take on, and then we will advance through the rest of the presentation? I think here's one that may be good to address and applicable to many. Does the school nurse need special training to perform eye screenings?
I can answer what I know of that. So yes, school nurses do get trained in how they perform screenings. So how that works. So comprehensive screenings, again, they're not just instrument based. You're sitting with the child and you're testing multiple different aspects of their vision. So like Dr. Brajas was saying, you're doing like a visual exam, you're checking for alignment. You're also then doing the traditional, like if you think about it from the eye screen with either whether that's shapes or letters that are up on the wall. So there's a lot that goes into that. So school nurses do go through training for that, and I think they even do recertification. So what that looks like and who trains them, I think, is state dependent. So there's a lot of state resources typically that help provide that for school nurses.
Thank you. And I think, this will be our last question. But there was a question about how do you guys set up the school-based exam specifically? Our attendee noted that this is the hardest part for us, being able to provide outside source to come in and provide the referral screening to get glasses. So if you can talk a little bit about that process, about the setup.
Going for the big logistical side of things, I will have to admit that some of this predates my time joining at Western University because I know they've always had a closer link with the nearby, somebody more nearby to us, which is the Pomona Unified School District. In their entity, they've always had an open communication. And similarly, for them, we do more just basic school screenings. But I guess that word kind of spread around to other districts. I mentioned the San Bernardino one where we kind of now create that setup, but we're starting to go deeper into LA, Los Angeles. So I do apologize if I get a lot of details wrong here, but my understanding is it takes a simple kind of connection between somebody on the clinical side of things. Universities are usually very nice for that. If you have a nearby College of Optometry, they would love to help with that. So find out who their clinical dean is of sorts. And then one simple email message of some sort would kind of get you that pathway. Um, at least that's kind of how I understood happened with Pomona, since we're right next door neighbors. But besides that, I can always talk about logistical while setting up. We have a fancy van that holds all this equipment and good old, sweat equity in it.
Thank
Yeah, I think
you.
there's lots of models for school-based health services, and vision is one of those too. So he's mentioning it. There's like what we call roll on, roll off, where you might have providers that come in and set up vision lanes, like that picture that Dr. Brajas did. So then that requires the school to work with you on like what that space looks like. Mobile units often are another option. So there are some vision centers that they bring the students out to the mobile unit, and they might have 2 vision lanes in that unit. And then a third one is just a fixed school-based vision center, and then using school transportation to get over to that fixed site. So lots of different options. And then the other part I think that they might be referencing in that question is then there's a lot that has to go into both consent and insurance, right? So thinking about from your provider side, do they have experience in doing this before? Who are they providing services to? What does it look like if you have a student that doesn't have any insurance or has private versus Medicaid? So those are all like conversations and communication and transparency you just need to have with your partner from the get-go to understand what their current process is. And they'll have a process. So because they're providing care often in a fixed site in addition to that. So I think it's just really important to think about all of those questions ahead of time. And as you're setting up with a new provider, talking that through. What does it look like for the glasses? Do they have to fit them? Do they want them to come back for that? Do they just distribute them at the school? Do they have the frames on hand to choose from, or are they just giving them a prescription to get them somewhere else? So, all great questions and lots of different ways that can be set up.
Thank you. Thank you for that. And I just want to again thank our attendees for just being so engaging during this session. If we didn't get to your question today, please feel free to follow up with us. We're happy to continue the conversation, and we'll talk about some opportunities to do that, some other webinar opportunities that I think would also help to address some of the questions that you all have. So before we wrap up, we really appreciate your feedback. You should now see a short evaluation poll pop up on your screen. This will only take a minute or two, and your responses truly help us improve future trainings and just better support your work. We especially value hearing what was most useful today and what you like to see more of moving forward. So please take a moment to complete that poll now. And while you all are doing that, I will thank you, Harper, for putting up that next slide. Just want to share an upcoming opportunity. So as you're finishing up that poll, I just want to highlight our upcoming webinar that really builds directly on today's conversation. So on April 23rd, we'll be hosting a webinar entitled The Shared Vision, Building Community Partnerships for School-Based Eye Care Programs. This session will really focus on how to strengthen partnerships between schools, health centers, and community providers to improve access to care for students. So really a great segue in terms of the last question that we had. We'll really be diving into practical strategies and real world examples of how these collaborations can help close the gaps in care and better support follow-up. So if today's discussion around coordination and screening and follow-up really resonated with you, this will be a great next step. So we encourage you to register and continue the conversation with us. I look forward to each of you joining us again on April 23rd. I also want to make sure you're aware of another exciting opportunity. Registration is now open for our upcoming school-based healthcare conference. So please join us in DC, June 23rd through the 25th. This is really a great space to continue conversations like the one we had today, connecting with your peers, learning from other experts, and just exploring practical strategies to support students' health and learning. So if you're interested, and I hope you all are, you can scan the QR code on the screen or select the link provided, or even visit our website to learn more about and register today. So I look forward to seeing you all in DC this summer. And just before we close, I want to encourage each of you to stay connected with us even beyond today's session. So you can subscribe to our bi-weekly digest for updates, resources, and upcoming opportunities. We share tools and insights that can support your day-to-day work in school-based health. So of course, follow us on social media. We're active across many platforms as well. All right. So I want to take a moment to thank you all again for joining us today. A special thank you to our presenters for sharing their expertise and helping us better understand how vision and eye health intersect with student success. This work really does take a team. Our students, our school-based health centers, our school nurses, providers, educators, families, and other community partners. And your role in that ecosystem is incredibly important. So we appreciate the work you're doing every day to support children and adolescents. Thank you again for your time. We hope you leave with practical insights you can bring into your work, and just have a wonderful rest of your day. Thank you all.